Albuterol, also known as Proventil and Ventolin. Class: bronchodilator, sympathomimetic, beta 2 specific. Action: relaxes bronchial smooth muscles by stimulating beta 2 adrenergic receptors. It produces bronchodilation, relieves bronchospasm, and reduces airway resistance. Onset: nebulizer 5 minutes. Peak: nebulizer 1 hour. Duration: nebulizer up to 5 hours. Indications: Indication 1.1: respiratory distress in adults with suspected non-cardiac and pediatrics with bronchospasm. 1.2: allergic reaction / anaphylaxis. This is anaphylaxis with respiratory involvement. 1.3: burns, respiratory distress with bronchospasm. For indications 1.1 through 1.3, the dosage and route for adults is 6 milliliters via nebulizer. May repeat. For pediatrics, it is to reference the pediatric dosage chart and then deliver via nebulizer. May repeat. In cases of respiratory distress with suspected non-cardiac for adults and pediatrics with bronchospasm, as well as allergic reaction / anaphylaxis. This is anaphylaxis with respiratory involvement. Ipratropium is to be added to the first dose. Indications 2.1: CPR / arrhythmias, PEA. This is for suspected hyperkalemia. Indication 2.2: CPR / arrhythmias, PEA / asystole. This is also for suspected hyperkalemia. 2.3: hemodialysis patients. This is for suspected hyperkalemia with a widened QRS complex or peaked T waves. And 2.4: this is for crush injuries, trauma, requiring extrication with compression of extremity or torso greater or equal to 2 hours. This is to be done immediately prior to the anticipated release. Now the dosage and route for 2.1 through 2.4 in adults is 6 milliliters via nebulizer continuous. And for pediatrics, it's pediatric dosage chart, then delivered via nebulizer continuous. Contraindications for albuterol. There are no contraindications for adults. For pediatrics, it is to avoid for croup and stridor. In cases of croup and stridor, nebulized saline / epinephrine is indicated. Adverse effects for albuterol: tachycardia / palpitations, dizziness, headache, tremors, and nervousness. Special information: packaging: 2.5 milligrams per 3 milliliters. Optional is a metered dose inhaler. Administration: obtain room air O2 saturation prior to oxygen administration, if possible. Use with 4 to 6 liters of O2 for a handheld mouthpiece, and use with 6 to 10 liters of O2 for aerosol mask, CPAP, and ET tube. Cautions and considerations: if concerned about aerosolized infectious exposure, substitute with a metered dose inhaler, if available. An albuterol metered dose inhaler is ALS optional item S-1023. At the BLS level, you may assist the patient to self-medicate their own prescribed albuterol MDI, that's metered dose inhaler, once only. Base hospital contact is required for additional doses. Examples of albuterol metered dose inhalers are ProAir, Proventil, Ventolin, and Vospire. Special info. Levalbuterol may be considered as an alternative to albuterol in the event of a medication shortage. Continuous nebulized albuterol is the goal for hyperkalemia and patients in respiratory distress. Ipratropium is not added to albuterol for hyperkalemia, burn patients, and crush injuries. Albuterol decreases hyperkalemia associated with dialysis patients by facilitating the movement of potassium back into cells. AEMT may administer per state regulation and local protocol. Ipratropium bromide, also known as Atrovent. Class: bronchodilator, anticholinergic. Action: it antagonizes the action of acetylcholine, preventing the interaction of acetylcholine with muscarinic receptors in the bronchial smooth muscle, causing bronchodilation. It also dries respiratory tract secretions. Onset: via nebulizer is within 15 to 30 minutes. The peak via nebulizer is 1 to 2 hours, and the duration via nebulizer is 4 to 5 hours. Indications: 1.1 Respiratory distress in adults with suspected non-cardiac and pediatrics with bronchospasm. In indication 1.2, allergic reaction / anaphylaxis, and this is anaphylaxis with respiratory involvement. The dosage and route for 1.1 through 1.2 for adults is 2.5 milliliters of 0.02% concentration via nebulizer, and this is to be added to the first dose of albuterol / levalbuterol. For pediatric patients, the dosage / route is to reference the pediatric dosage chart and then administer via nebulizer. This is to be added to the first dose of albuterol / levalbuterol. Contraindications for Atrovent, ipratropium bromide. There are no contraindications. Adverse effects for ipratropium bromide, Atrovent. Adverse effects include dizziness, headache, cough, and blurred vision / eye irritation in cases where there is direct contact with the mist. Special information. Packaging: 0.5 milligrams per 2.5 milliliters of a 0.02% unit dose vial. Administration: obtain room air O2 saturation prior to oxygen administration, if possible. Use with 4 to 6 liters per minute of O2 for handheld mouthpiece, and use with 6 to 10 liters per minute for aerosol mask, CPAP, and ET tube. Cautions and considerations. Ipratropium is not added to albuterol for hyperkalemia and burn patients. At the ALS level, if concerned about aerosolized infectious exposure, substitute with metered dose inhaler, if available. At the BLS level, you may assist the patient to self-medicate their own prescribed metered dose inhaler once only. Base hospital contact is required for additional doses. Ipratropium bromide metered dose inhalers include Comivent and Respimat. Special info. Cholinergic effects are site-specific in the lungs. There are no systemic effects. It is not authorized for AEMT administration. Midazolam, also known as Versed. Class: it's a benzodiazepine, sedative / anticonvulsant. Its action: it is a CNS depressant. It produces anterograde amnesia and then sedation, and it stops and prevents seizures. Onset: via IV, IO, and IN is 2 minutes. The onset intramuscular, IM, is 15 minutes. Its duration for all, meaning IV, IO, IN, and IM, is 1 to 4 hours. Indications: Indication 1.1, altered neurological, specifically seizures, and this is status epilepticus with generalized, ongoing, and recurrent seizures without lucid intervals. The dosage and route for adult patients is going to be patients equal to or greater than 40 kilograms are going to get 10 milligrams intramuscular. Patients weighing less than 40 kilograms will get 0.2 milligrams per kilogram intramuscular. If vascular access is present, 0.2 milligrams per kilogram is to be delivered intravenous or intraosseous to a max of 5 milligrams. You may repeat once in 10 minutes, with a max of 10 milligrams total. Discontinue if seizure stops. In pediatric patients, reference the pediatric dosage chart and deliver intramuscular. And if vascular access is present, again, reference the pediatric dosage chart and deliver intravenous or IO. May repeat up to once in 10 minutes. Indications 2.1, altered neurological seizures. This is for partial seizures lasting greater than 5. This includes seizure time, PTA, a pre-hospital provider. 2.2, obstetrical seizures. This is for eclampsia seizures in adult patients. The dosage and route for 2.1 and 2.2. For adults is 0.2 milligrams per kilogram, intranasal, intramuscular, intravenous, or intraosseous, to a max of 5 milligrams. You may repeat once in 10 minutes, to a max of 10 milligrams total. Discontinue if the seizure stops. For pediatric patients, the dosage and route is to be referenced in the pediatric dosage chart, then delivered intranasal, intramuscular, intravenous, or intraosseous. You may repeat once in 10 minutes. Indications 3.1, dysrhythmias, specifically unstable bradycardia, per required need pre-pacing. 3.2, dysrhythmias such as unstable SVT and VT, to be considered prior to cardioversion. And 3.3, dysrhythmias, unstable AFib and aflutter, with a rate of equal to or greater than 180, consider for precardioversion. For indications 3.1 through 3.3, the dosage and route for an adult is 1 to 5 milligrams intravenous or intraosseous. The dosage/route for pediatric patients is to reference the pediatric dosage chart and then to deliver IV/IO, base hospital order for pacing, and pediatric dosage chart to be delivered IV/IO, standing order for cardioversion. Indication 4.1, pre-existing medical intervention. This is for intubated patients who present with agitation and potential for airway compromise. For an adult patient, the dosage/route is 2 to 5 milligrams intramuscular, intranasal, or intravenous. You may repeat this once in 5 to 10 minutes. There is no dosage and route for any pre-existing medical intervention, considering intubation for pediatric patients. Indication 5.1, psychiatric behavioral emergencies. This is for severely agitated and or combative patients requiring restraint for patient or provider safety. The dosage/route for 5.1 is 5 milligrams intramuscular IN/IV for adults, and this can be repeated once in 5 to 10 minutes. The dosage/route for pediatric patients is to reference the pediatric dosage chart and then to deliver intramuscular, intranasal, or intravenous, and this can be repeated once in 10 minutes. The contraindications for midazolam, also known as Versed, for adults are none, and for pediatric patients are also none. The adverse effects for midazolam, also known as Versed, are respiratory depression and apnea. Special information. Packaging: 5 milligrams per 1 milliliter or 10 milligrams for 2 milliliters. Administration: midazolam should be administered slowly, intravenous or intraosseous, at a rate of 1 milligram per minute. Discontinue IVIO administration if, when seizure activity stops. Discontinue IVIO administration for precardioversion if the patient shows signs of sedation or demonstrates amnesia. Cautions and considerations. Co-administration of midazolam in patients with alcohol intoxication can cause respiratory depression. Consider avoiding or reducing dose in these patients. Carefully monitor respiratory rate, tidal volume, O2 saturation, and end-tidal CO2 during administration. Monitor end-tidal CO2 per required need. Precardioversion sedation is recommended whenever possible. Consider lower dose for precardioversion treatment with attention to age and hydration status of the patient. For severely agitated and or combative patients, intranasal or intramuscular is the preferred route to reduce risk of injury to the patient and providers. Injection may be given through clothing into the thigh for crew safety issues. Special info. Midazolam is treated as a controlled substance and is to be secured/signed for when used. Midazolam is not indicated in febrile seizures. Consult the base hospital for unusual presentation or if uncertain. It is not authorized for AEMT administration.